If you're on Medicare or preparing to go on Medicare in 2024, you have quickly found out that Medicare is not free. I know it's disappointing, but there's always a cost to Medicare, and those prices continue to increase. So what I'm going to do in this video is we're going to talk about the premiums for 2024, whether you're on an original Medicare or a supplemental plan or a drug plan or an Advantage plan. Those prices are changing. In this video, I'll explain. As most of you know, Medicare has four moving parts, parts A, B, C, and D. And so we're going to look at all the premiums associated with those plans to make sure that you're making the right financial decision for you. So let's get started with Medicare Part A. For the majority of people, Medicare Part A is going to be premium free. The reason for that is because as long as we have 40 quarters paid into the Medicare tax system, then we get premium free Medicare A. Now, if someone doesn't have their own 40 quarters, they can get that from a spouse, either an existing spouse, as long as that spouse is 62, been married for a year, or an ex-spouse, as long as you're married 10 years, and that person is eligible for Social Security at 62, and you did not remarry prior to the age of 60, then again, that ex-spouse, you can draw off their work record. But the point is 40 quarters of you or a spouse, existing spouse or deceased spouse, can give us Medicare Part A at no cost. Now, there are some people who don't have 40 quarters, so some people do have to buy it, and so since this is all about premiums, let me mention that real quickly. Anyone that has somewhere between 30 to 39 quarters, Medicare Part A in 2023 and 2024 was the same. It's $278 a month. So if you have those many quarters, you can't get to 40, you have to buy it. Anyone that has anywhere from 0 to 29 quarters, next year it's going to be $505, meaning I'm shooting this video in 2023 in November. So in January, if someone's buying Medicare Part A, it's going to cost them $505 a month. Actually went down $1. All right, so I do want to mention just one more thing. If people don't have 40 quarters, but they're close, to earn the quarter next year in 2024, you have to have $1,730 of taxable income, and that gets you a quarter. We cannot get more than 4 quarters in the year, but we don't have to work the whole year to get 4 quarters. And so we'd multiply that times 4, and that's going to be $6,920 of W-2 income or net self-employment income that's reported on your taxes, and that would then get you 4 quarters for the year. All right, so that's Medicare A. Let's look at Medicare B. Now again, I'm shooting this video. It is November the 9th of 2023, and right now the premium for Medicare Part B for most people is $164.90 a month. It's going up in 2024 to $174.70, $174.70. Now that Part B premium, if you're on Social Security, comes right out of your check. If not, they will actually set up a bank draft called Medicare Easy Pay. You can go online, Medicare.gov, mymedicare.gov, and pay that, or you can actually have a quarterly bill sent to you, so that'd be times 3. So that's the Part B premium for the majority of people. About 92% of all people are going to pay $174.70. And again, this is going to cover us on all of our outpatient, doctor services, and those kind of things. A is inpatient, B is outpatient. So everyone has to pay unless you qualify for 100% Medicaid. And that would be what's called a Medicare Savings Program. And then those people wouldn't have to pay for their Part B, but the majority of people are going to. Now, I want to clarify something about this premium. This premium is based upon your income. A, we got at 0 because of 40 quarters. Not so with B. B is going to be based upon not upon quarters, but upon her income. And so what happens if someone is going to be on Medicare in 2024, the government's going to look at their 2022, what we call modified adjusted gross income. So this year, 2023, you're looking at 2021. In 2025, they're going to look at 2023. So they're always looking back 2 years. So modified adjusted gross income, very easy formula. It's line 11 on your 1040 plus line 2A. Line 11 is adjusted gross income. Line 2A is tax-exempt interest. So these two together equal our modified adjusted gross income. So if the modified adjusted gross income is below certain thresholds, the single payer, single filer threshold in 2024 is going to be $103,000. The married filing a joint return, not separate return, will be $206,000. So as long as we stay below those income, modified adjusted gross income thresholds, thresholds, then our premium next year will be $174.70. If we're going to be above those thresholds, then we're going to have additional amounts, and those additional amounts are called IRMAs. Now, I want to clarify something real quickly. The reason this number is that amount is because what happens, the government every year projects what Medicare is going to cost them. So this year, of course, 2023, so right around the spring, summer of this year, they've been projecting what's it going to cost them to cover the average person on Medicare B in 2024. So again, they project that. And so they take the billions of dollars they're projecting to spend, divided by the millions of people that are on Medicare, and they come up with a monthly number. And what they're projecting is that it's going to cost them in 2024 $700 a month to cover the average person on Medicare. And so at these income levels, what's happening, and again, I rounded this up a little bit just to make it simple, the person at these income levels is paying 25%. That's 25% of that number there. So you, the Medicare beneficiary, if we're in these income levels or below, you pay 25%, and then the government pays 75%. But again, if we're going to be above these limits, now we're going to have to pay more. And those that are above these limits have to pay what's called an IRMA. Let me show you that. Now, IRMA actually stands for Income-Related Monthly Adjustment Amount. And again, these are people that are above 103 as a single, 206 as a couple. So everyone is going to have to pay that $174.70 for their Part B premium. But if we're above those limits, what happens now, they're going to add to our Medicare B, and they're also going to add to our Medicare D drug plan. All right. And so, again, we have 5 different levels of IRMAs. I'm not going to get into all those right now. You can find these online, of course, if you can see the chart as well. So let's just make it real simple. Let's say, let's just use the first IRMA level. So single between 103 and 129, couple 206 to 258. So let's just say it's a couple, and they're at $250,000 modified adjusted gross income in 2022. Then they are going to have to pay an IRMA of $69.90 each, and on their drug plan, whatever drug plan they choose, they're going to have a $12.90 IRMA each for that. So we put those two together, well, that's about $83 that they pay extra because they're at this income level. And so as income levels go up, IRMAs also are going to go up. And so what's happening here? Remember what I said? If I'm below 103 or below 206, you are paying 25% of that $700, what it costs the government to cover you. When they add this IRMA, what's happening is you are paying 35% of the cost. Here, you're paying 50% of the cost. Here, 65, here, 75, here, 85. And basically what they're saying is if you're high income, we're not going to take as much out of the budget to offset those expenses. All right, now, what's important to note is this, that these IRMAs are recalculated every year. So these numbers are not fixed other than just for 1 year. They'll recalculate it and let you know if you're going to have an IRMA that you're going to have to pay for. And just remember, whatever drug plan you choose, let's say you're on a drug plan that costs $10. At these income levels or less, you just pay the $10. But if we have an IRMA, they're going to take the drug premium plus the IRMA, and that'll be what it will cost you to be on that particular drug plan. Now, let me show you, that's kind of the bad news. Let me show you the good news. For some of you, you will have the right to appeal the IRMA. So we actually appeal the IRMAs that are established here with a form called an SA-44. And there's actually 8 life-changing events that would allow you to appeal the IRMA. Appealing the IRMA means that what we're saying is the government's naturally looking back 2 years. But if I have a life-changing event that happened a year ago or just happened this year, then I can say, stop looking back. I've had a life-changing event. It could be a death. It could be divorce. It could be work stoppage or work reduction. It could be marriage, loss of income-producing property, loss of pension income, an employment settlement change. So there's 8 of these events, and they're all in the SA-44. So if you had that happen, you put the date in there, and then you're saying through the appeal, stop looking back at 2022. I'm going to give you 2023 numbers or project for 2024, and they will actually look at those numbers, and they will drop off the IRMAs, or maybe sometimes even reduce the IRMA, because sometimes we'll have people that will still be considered high income, but maybe they're here 2 years ago, but now they're just up here. So they can either reduce the IRMA in an amount, or they can eliminate take the IRMA total. And so again, if you work with us, our clients, we help them appeal their IRMAs all the time. We'd be happy to do this. But the point is, we're going to have IRMAs, but there are life-changing events that would allow you then to appeal those so you can get those reduced or eliminated. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so we have A and B covered, and most people that stay in original Medicare A and B are going to get some type of a supplemental plan, which also carry premiums. Now, I'm going to kind of keep this high level. I've got plenty of YouTube information about particulars of supplemental plans, but I think the main thing to know is this. When we have Medicare Part A, what we have is this is the inpatient side, the hospital side, skilled nursing side of Medicare. We have 3 gaps on the A side of Medicare. Gaps meaning Medicare pays first, doesn't pay anything 100% other than preventive services, so we always have a financial gap, a liability that you're responsible for. So there's 3 gaps on the A, and that would be a deductible to go to the hospital. It would be co-pays for extended hospital stays, so that would be this, and then they have co-pays for extended skilled nursing stays, skilled nursing. Those are your 3 gaps on the A. The B side of Medicare, which is everything outpatient and doctor services related, we also have 3 gaps. Okay, we have a deductible. Now, by the way, this deductible on the A side can happen more than once in a year. The B deductible is just simply once a year. And then we have co-insurance. Medicare pays 80% on the B side. You pay 20%. And then we have a thing called an excess. Excess is when a doctor, and only a doctor can do it, adds 15% to the bill. Now, this doesn't happen often. I would say it's very rare, definitely less than 5% of the time. But when we have an excess charge, Medicare allows it, but you have to pay for it. All right, so point is, those are our 3 gaps. And so the majority of people today that are going on Medicare are either getting an F gap plan or supplemental plan, we call them, a G plan or an N plan. All right, so here are the differences. We're talking about premiums. And so if I have an F plan, what it does, it covers all 6 of 6 gaps. So it pays everything. People on F plans should never get a bill. Now, the problem with F plan today is they're pricey, but most people can't buy them because you had to be born before January 1st, 1955, or having had to start Medicare before 1/1/2020. Okay, if that's you, you can still get an F plan. Again, they're not a real good value today, but they're still available. Anyone who has them gets to keep them. They're not losing them. But for people born after 55, after starting your Medicare after 2020, now the G plan would be one of the top plans, and it covers 5 of the 6 Medicare gaps. What it doesn't cover, it does not cover the Medicare B deductible. This year, that's $240. It's once a year, and it resets every January. So a person has a G plan, Medicare pays first, G fills in all the gaps, but once a year the B deductible. Then we have another plan popular today called the N plan. It covers 4 of the 6 gaps. So what it doesn't cover, like the G, doesn't cover the B deductible, only the F does that, and it will not cover excess if and when that occurs. Again, I said it's rare, less than 5% of the time, but if you did have that happen, you would have to pay for that out of pocket if you had the N plan. Plus the N plan has up to a $20 copay to see a doctor, a specialist, and you go to the emergency room, going to cost you a $50 copay. So again, every time we take on a little bit more of a risk, they're going to lower the premium for us. So these are your top plans. So here's my point. Now again, we're a nationwide brokerage company. We're right in all 50 states. So I'm just going to give you a range. Where you live could be higher, where you live could be lower. These are just simply averages. Right now, those F plans are ranging in about $150 to $200 a month on a premium for that full coverage plan. G plans are going to be in the neighborhood of somewhere between about $110 to $150. Your N plans are going to be somewhere between $90 to about $120. And again, those are going to be monthly premiums. So those of you that are on F plans, what you can do is you can move to a G. Now, in most states, we're going to have to medically qualify to do that. But again, you can save some substantial money, could move down to an N plan and save even more money. Those of you on a G plan, you can move to an N if you wanted to. Now, some people that are on G plans, if you've been on that plan for maybe 3 or 4 or 5 years, you could always reshop it and just move from G to to G, or you're on an N plan, reshop it, move from N to N. And this would be a way that you can save premium. But remember, in the majority of states, you are going to have to medically qualify to switch from a supplemental to another supplemental plan. All right, so that's the premiums related to Medicare supplemental plans. Let's keep going. Now, when a person is on Medicare, Medicare and Advantage plans as well, C plans, will pay for professionally administered medications. That's through the A and B or through the C. So meds I get in the hospital, meds I get on an outpatient basis, those kind of things are covered through A and B and the C plan. But for self-administered medications, the meds I'm taking on my own, cholesterol, blood pressure, insulin, those kinds of things, I self-administer, I have to have a Part D plan for those kind of meds. And so what we're talking about now are self-administered meds. So there's one of two ways in which we get a drug plan. If I make the choice to stay in A and B, and I get, let's say I get that G plan or that N plan, then I'm going to have a separate prescription drug plan. We actually call these standalone drug plans, standalone. Right? So that's one way I can get my meds. Now, another way in which I could get meds, this would be my second option, is I enroll in A and B, but instead of using A and B, I get a C plan. This is going to be an Advantage plan. So we call those MA plans. And so the majority of MA plans today actually will also include a prescription drug plan. So that's why we call them MAPDs. So this is integrated. It's included, all right? So it's integrated within your Advantage plan. So either way you go is going to determine your options for your prescription drug plans. And so what I want to talk about is this one first. So when we talk about standalone drug plans and premiums, again, these change year to year, but most markets right now have anywhere from about 15 to 24 RX plans to choose from. 2/3 of them actually went up in premium, and 1/3 of those went down. Okay, so the point is there have been some adjustments. So you want to make sure you look at your drug plan to be sure that you're going to be on the best drug plan. So here's what happens. We have some plans that are $0 monthly, and there's some that could be as high as $80, $90 on a monthly basis. I think the average this year is going to be right around $25 a month for a standalone drug plan. Now, not only do I have to pay the premium, but now I could have some copays. If your meds are cheap, you may have very low copays. If they're expensive, you're going to be more out of pocket. And so you just want to make sure year to year that you're on the right drug plan. Now, if I have A and B, that's for life. If I have my G or N plan or F plan, whatever supplemental plan you have, that's for life. But these are only written for once a year. So what we can do every year, October 15th through December the 7th, is your opportunity to be able to switch drug plans. So I have 7 weeks to switch, and that new drug plan will go into effect January 1 of the following year. So again, they're annual plans. You don't have to medically qualify if that plan's in your zip code and it's going to be a good fit for you, for your meds and for your pharmacy choices, then you can enroll in that plan. And again, it would start then January 1, and that would be your plan for the calendar year. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, then that brings us to what we would be some optional, really voluntary benefits. So if I have A and B, I get a supplemental plan, again, either that G plan or that N plan to fill in the gaps, 5 of 6, 4 of 6, right? And then I added a prescription drug plan to that. And again, there's a separate premium for that. And so just as a general rule, we know that A is 0, B is $174.70 next year. Let's just say you're on a G plan that costs $120, and you're on a drug plan that costs $125. What are we talking there? We're talking about $320 for that package. Only thing I'm liable for is once a year I've got to meet that B deductible, which is going to be $240 in 2024. This is 2023. The B deductible is $226. It went up $14. But the point is, I'm going to pay this is for sure on a monthly basis, I'm going to be out of pocket this, medically speaking. So this is one of my options. So some people are concerned about dental as well as vision. So when it comes to dental, Medicare really doesn't cover much for dental. Now they'll cover serious stuff. Someone has jaw cancer, there has to be some reconstruction of the teeth. Medicare covers that. If you're going into a kidney replacement, some type of heart surgery, they're going to check your teeth to make sure that you're healthy enough with your teeth to be able to go through that surgery. So the point is they pay some, but not normal standard things, extractions and fillings and root canals and crowns and dentures and implants and all that. Medicare doesn't cover that. So sometimes people will get a dental plan that again is a standalone dental plan. Those dental plans are going to range typically anywhere from about a benefit annually, anywhere from $2,500 to about $5,000 that the plan would spend on you. There's a lot of rules. I've got plenty of videos on that, but if we're going to talk about premiums in the video, we got to be aware that sometimes people do this. These plans are going to be anywhere from about $40 to $50 a month, okay, and this would be per person. So if husband and wife are on one, we're talking $80 to $100. But again, these are dental plans. Some are PPOs, some are network plans, but the point is you may have a premium from that if you decide you want some dental coverage. About half of our clients get dental, half don't. Again, that's something you're going to have to decide. Now, when it comes to vision, you can usually add a vision benefit to a dental plan. Now, you have two types of plans right now. Most carriers are going to offer you either iMed Network or VSP. Right now, iMed's about $10 a month, and VSP is about $15 a month on an add-on. So you can actually add that or have that just as standalone plan. Now, keep in mind, in original Medicare, you have great vision coverage. If you have glaucoma or cataracts or macular degeneration, disease of the eye, all those kind of things, eye problems, you're going to get great coverage through original Medicare. But original Medicare doesn't cover preventive eye exams for eyewear or eyewear. So those are the two things they don't cover. No glasses, no contacts unless after cataract surgery, and no eye exams unless it's medically necessary. They will. Okay, so then these vision plans then will give you one eye exam a year, and they'll give you either discounts or good prices, good values on frames and lenses and contact lenses, those kinds of things. Okay, so some people decide that they want to add that to it. So when we look at our premium, we know we're about $320. And then if you want dental or vision, you're going to have to add that as well. All right, this is our last slide. I want to explain just real quick as we talk about premiums. Let's talk about Medicare Advantage plans. These are Part C plans. These are called replacement plans. Now, when it comes to Medicare Advantage plans, what's happening, you do have to be enrolled in A and B, which means what? You're going to have to pay that $174.70. But beyond that, Advantage plans almost always are zero premium. 2024, about 2/3 of the plans have zero premium. So we actually can enroll in that C plan and we have a zero premium. Now, there are a few that have some very low cost, but a lot of them are zero. So let's just assume zero for now. Now, they're going to include a D plan at zero premium as well. So if I'm just looking at premiums alone, this is going to be $174.70. Remember what we said on that Med Sup? What do we have? About $320 on a monthly basis. This is $174. Now here, I don't have much out of pocket after that other than the B deductible or my excess if I have an in plan. But here what's going to happen, my premiums are lower, but now I'm going to have to pay copays. So I see a specialist. It may cost me $25 or $50. Go to the hospital, maybe $300 to $400. Having a CAT scan, MRI, maybe $200 to $250. And so Advantage plans have no premium, but what we do is we pay as we go. We pay as you go. So meaning what you're doing here is you're taking on the risk of whatever healthcare services you may need throughout the year. Here, I don't have much risk because I'm going to have to have very little out of pocket. And so here, I pay as I go. And if you're healthy, you may not have a lot of out-of-pocket expenses. But if you have some serious health issue, you may. Because not only do I pay copays, but some services I got to pay coinsurance at 20%. But the good news is, if I'm paying copays and coinsurance, there will be a limit, and we call that the annual max out of pocket. HMOs right now are somewhere between, on the average, about $3,000 to $4,000. PPOs somewhere between about $4,000 to $7,000. HMOs got to stay in network. PPOs you don't. You can go out of network on a PPO, but it costs you more money. All right, and so the point is, once we hit the max, we're done for the year, and then that will reset in January. And so as we compare these two two options. What you have to decide is, what are you most comfortable with? People over here say, I'd rather pay the premium, not have a lot of risk. People over here say, no, I want to do that, and I'll just take the risk and pay as I go. And so there is no right or wrong, good or better. The only difference is this. You have to make sure you understand that these two systems of insurance are going to work differently, because the only thing they have in common is I've got to be enrolled in A and B to have a SUP. I've got to be enrolled in A and B to have an Advantage plan. And so there's things here that are a little bit differently. Number one, you got to realize that every Advantage plan is going to put you in a network. You get to choose the network, but it's going to be HMO, PPO. If I have a supplemental plan, I don't have that, because I can go to any provider, any hospital, any doctor that takes Medicare. So that's number one difference, networks. Number two difference is what we call pre-authorizations. Pre-authorizations. So this is a healthcare service that's kind of expensive. It can be a scan, hospital stay, skilled nursing stay, surgery, hip replacement, knee replacement. Any of those things are going to have to be pre-approved by the Advantage company. So they frankly have the right to say, yes, we agree with the doctor, or no, we don't, or we're going to delay it. We think you ought to have therapy for a while or try meds for a while before we approve that surgery. And if that's what they say, that's what happens, because they agree. I mean, because you've agreed when you entered that plan that they have the pre-authorization authority. And if they're not going to approve it, they're not going to pay for it. All right. And so the point is, you have pre-authorization with Advantage. When it comes to supplemental plans, one of the things we're paying for is we don't have pre-authorizations by the insurance company. They cannot interfere in any way. Your doctor and Medicare make all the decisions. Over here, truly the final say-so is with that insurance company. So yes, I've got a low premium. Sorry about that. But again, I'm going to have pre-authorizations. And then also, you got to keep this in mind, and I'll close this out. And that is this. There is a possibility that if you go on an Advantage plan and you stay on that Advantage plan for a year, 2, 3, 4, 5 years, and you want to get off of it, and you want to come over and get that supplemental plan, now you have to go through medical underwriting, except in 4 states, New York, Connecticut, Maine, and Massachusetts, all 46 states and the District of Columbia, to get off the Advantage. Now you have to medically qualify, 30 health questions, check all your meds, get a statement from your doctor, and those insurance companies do not have to take you when you get off the Advantage and go to the supplemental plan. Okay, so you have to medically qualify. So as you look at these two different options, you're going to have to decide, do I want to pay a premium, or whatever, to keep my premiums low and just take the risk of paying as I go? And that's fine as long as you're comfortable with networks, pre-authorizations, referrals, as well as the permanency of being on that plan.